Good afternoon, everyone. This is Mark Lynn from Healthcare Business Specialists in Chattanooga, Tennessee. This is the last of our lunch and learns for a little while until we're all headed out to the National Association of Rural Health Clinics meeting next week. So we will learn a lot, and we'll come back and try to share some of that information with you in some more lunch and learns in the future. But today's subject, and it's an extremely important subject, is what RHCs need to know about the HRSA update to HPSA Shortage Designations. And Joe Lampard and Alex Johnson from HPSA Acum, they're going to be our presenters today, and will tell us why this is important, what you need to do, and what impact it's going to have. Here is my contact information if you need to get a hold of me. Danny Gilbert is here with us as well, so she'll be taking care of the technical aspects. If you have questions or can't hear or all that sort of stuff, she'll handle that. Here is a listing of what we do. We prepare program evaluations, we prepare cost reports. Just a reminder, we need those cost reports in now because they're due May 31st, and we're not going to get an extra 2 months to do it this year. So everybody that's behind, and I know a lot of you are behind, get those in as soon as possible. And if you've not joined our Rural Health Clinic Information Exchange group on Facebook, we have 3,500 members. That is the best way to find out information about the webinars and to ask questions from other consultants that can help you. And we can help you if you ask questions on there as well. If you have questions today, please type those into the sidebar. Over here, there's a questions panel, and we will ask those to Joe and Alex at the end of the session. Disclaimer, everything is current as of today, and this session is being recorded for people to watch later on. If you want to find the slide presentations, they are on our website at ruralhealthclinic.com/RHC webinars. I have administrative slides, and I have the slide presentation that Joe and Alex will be going through today as well. And then about our speakers, Joe, I've known Joe for a long time, probably close to 10 years or so. He's a vice president and partner at HPSA Acum. I know anytime we have an issue with a HPSA or with National Health Service Corps or anything like that, I'm going to forward an email to Joe because he's the best in the business for this. So I've known Joe for a long time, and then Alex is his right-hand man with HPSA Acum as well, and so they will be giving you a presentation today. And without further ado, I am going to make Joe the presenter. So Joe, I'm going to turn it over to you, and you are in control. Thank you very much for doing this.
Absolutely. Well, thank you, Mark, for the introduction. And our focus is on HPSAs, and right now there's a lot going on in the health professional shortage area world with some of these updates that have happened at the federal level. And so we're going to review the benefits, what the HPSA program is, and we're going to look at what exactly happened back in September and what that means for rural health clinics. Can you see my screen? Great.
Yes, Joe, we can see it.
Okay, so we are located here in Western New York, and we focus on health professional shortage areas, also the medically underserved areas and medically underserved populations. Those can also be used, the MUAs, for rural health clinic setup, change of ownership, moving a clinic. And we focus on the benefits of the HPSAs and helping with the site certifications and maximizing the benefits, really getting the word out that, you know, who's eligible, how much the program is worth for federal loan forgiveness or state loan forgiveness, and then sharing screen and walking the clinicians through the program they're most likely to receive funding from. And other types of shortage analysis, CHNAs, staff development plans. So HPSA overview. For those of you that are not familiar with HPSA, it stands for Health Professional Shortage Area. And it's a federal program to attract, recruit, and retain physicians. And as the program has developed over the years, it now also includes other types of clinicians. And there are three cohorts or categories. There's primary care HPSAs, mental HPSAs, and dental HPSAs. And each one of those cohorts has 5 different types. So there's a geographic HPSA, and what that is that is a shortage proven to the general population. So just in general, there's not enough primary care physicians or mental health workers, such as the core mental health workers or psychiatrists or dentists and hygienists. Then you can look at a more specific population and do a population HPSA, such as a low-income population HPSA, where you are proving there's a shortage to those under the 200% federal poverty level. Or you can, if there's a large enough population, look at the migrant workers, Medicaid, medically indigent, even cities can have a homeless population HPSA. And then rural health clinics have the added benefit of a facility HPSA. So you can prove you're in an area, you're designated, and you go through the National Health Service Corps program, you then can apply for a facility HPSA. And they often score higher than the area HPSA. So if you were in a county HPSA and you go through National Health Service Corps, you can apply for the facility HPSA. There are FQHCs, they automatically receive a facility HPSA, and then prisons can receive a facility HPSA. And lastly, certain states have the option for a governor's HPSA, and that is good for rural health clinic setup, but that is really the only benefit to the governor's HPSA. So each HPSA designation provides student loan forgiveness, J-1 visa waivers, so that's the recruitment of the foreign physicians, and National Health Service Corps workers. And those are the physicians that had their loans forgiven while they were in residency. So they graduate debt free, but they have to work in a HPSA so they could come work at your clinic. There are 40 state and federal grants tied to HPSA. And then of course, RHCs. The geographic HPSA, and only the geographic HPSA, provides a 10% Medicare bonus. That is outside of rural health clinics, the VA, FQHCs, prisons, because they already receive heightened Medicare reimbursement. But this bonus is for every type of MD-DO, so even specialists, chiropractors, psychiatrists, they all generate a 10% bump in Medicare for the life of the HPSA if you're in a geographic HPSA. And Alex is going to speak about National Health Service Corps, which is the largest federal loan forgiveness program, and Nurse Corps.
There are 2 federal loan repayment programs that are available across the country. These are in addition to any state loan repayment programs that you have available in your specific state. National Health Service Corps, this is outpatient oriented. It is a fairly lucrative proposition to receive this loan repayment program. It is $50,000 upfront for a 2-year service commitment. So the provider would commit to working at your facility for 2 years, and in exchange for that, they would receive $50,000 of tax-free loan repayment dollars. There are continuation contracts, so they can tack on 1 year continuing contracts for up to $360,000 over a 16-year period. It's great for the facility because these providers are committing to working with you. The agreement is between the provider and the loan repayment program. So if for some reason they sign up for this 2-year commitment and decide to leave after 6 months, it's not your responsibility to chase them down. It'll be the loan repayment program that chases them down. And there are some stiff penalties if they leave early. So once they commit to you, you can feel confident that they'll stick around for however long that commitment is. Say your provider has $38,000 in student loans. Instead of receiving that $50,000 up front, they'll receive the total amount of their current student loans, so that $38,000 in exchange for committing to those 2 years. And of course, there wouldn't be any continuation contracts after that.
And I did just want to add that there's no cap on the amount of loan forgiveness. So if they owed more than, we'll say $360,000, they can keep renewing until that education debt is fully forgiven.
And there's also no cap on the number of providers that apply from each facility. So here are the different specialties, the different disciplines that can apply to these programs. So if you have a primary care health professional shortage area, your primary care physicians, physician assistants, nurse practitioners, and certified nurse midwives can apply. If you have your dental designation, then your dentists and dental hygienists can apply. And if you have your mental health HPSA, then psychiatrists, your core mental health workers, including psychologists, social workers, counselors, therapists, they can apply. The eligibility requirements for the specific that are specific to the providers, they must be working 40 hours a week. This can be compressed into 10-hour days. It doesn't necessarily have to be a 5-day work week. Of course, they can take time off if they do have maternity or paternity leave, for instance, and they take 5 months off. That 5 months will tack on to the back end of the commitment. So they will still have that 2-year commitment to you in exchange for the loan repayment award. These are the requirements specific to the provider. There are also requirements that are specific to the site. So to become site certified, there are certain guidelines that National Health Service Corps requires, including a sliding fee scale or charity care, the acceptance of Medicaid and CHIP patients. But here's the process to determine if a provider is eligible. So as long as they are employed by the middle of July of this year, they're a U.S. citizen, they have their license that is full, permanent, unencumbered. They do participate or are at least eligible to participate in Medicare, Medicaid, and CHIP. They could be eligible for federal employment, and they also have an unpaid government or private student loan. This must not be combined with any other type of debt. So a lot of times providers with interest rates so low have combined their student loan debt into maybe a second mortgage or line of credit on the home. That would not qualify for a program like this. It must be completely separate, so it cannot be combined with credit card debt or a personal loan. It must just be student loans. Here's the timeline for National Health Service Corps. In the spring, which is coming up, I think it's April this year, there are National Health Service Corps site certification applications. So again, that would be your rural health clinic or your facility applying to provide eligibility for your providers. Once you are site certified, you will be notified in July or August. In September, the loan repayment awards are announced for those that applied in November or December of this year. I'm sorry, of 2021. So those awardees are notified in September, late in the summer. And then the next application cycle, it may be a bit up in the air. November and December is unique. That was the first time they had done that in 2021. We're not certain if it's going to be the same for 2022 or if they will go back to the typical application opening window, which is February and March. So that'll be something that we'll be on the lookout for, but it could be either time this year. So the sites that are eligible to become site certified and have their providers eligible for the program, these are outpatient focused. So again, it's your primary care physicians and advanced practitioners, your dentists, dental hygienists, psychiatrists, and core mental health workers in an outpatient setting. So you can see the list of eligible facilities. These provide outpatient, ambulatory, primary care, mental health, or dental health services, and they are in a HPSA designated area. National Health Service Corps really focuses on those areas that have a score of 16 or higher. What's nice, and Joe mentioned earlier, is that a rural health clinic, as soon as they become National Health Service Corps site certified, they can receive a facility score. That facility score, as mentioned, is typically higher than the area or regional score. So if your county, for instance, has a score of 14 or 15, and your rural health clinic becomes NHSC site certified, you very well could receive a score of 17 or 18 and put you well within striking distance for receiving those loan repayment awards for your providers. So keep that in mind. Even if you have a lower area score, you can still become facility scored and receive a higher score. And that score it signifies how drastic the shortage is for your area. It's on a scale of 0 to 25. 25 signifies the most drastic shortage. So the higher the score, the more necessary to bring in more providers.
And we did see funding jump massively between 2019 and 2021 to $800 million for this program. And it's expected to continue for another $800 million this year. So we did see even the lowest scores, as long as the application was filled out correctly, that it was approved. There are tens of thousands of applicants. So there's a software system that reviews to see, is it the right file type, are all the documents there, are you eligible? And so as long as it was filled out correctly and you were in a HPSA, you were in incredible shape to receive the initial $50,000. And once you're in the program, and if the score of the HPSA does decrease in the future, we do see those renewals still being granted at $20,000 per year moving forward, even if that score does drop.
Sites that are not eligible for loan repayment, they're your inpatient facilities. So your county and local prisons, your hospitals, except for critical access hospitals, as long as there's an outpatient clinic affiliated with that CAH, the physicians and the advanced practitioners can apply as long as they're providing care at those outpatient facilities. The other really great and poignant loan repayment program right now is called Nurse Corps Loan Repayment Program. Of course, you're all well aware of the shortage of nurses across the country. This Nurse Corps program, there also is some scoring thresholds associated with this. And of course, you must be HPSA designated. So any of those that are currently on the proposed for withdrawal list, your providers are not eligible for National Health Service Corps nor Nurse Corps. But Nurse Corps, it is another great program. So your providers can receive up to 60% of their debt repaid in exchange for a 2-year commitment to your facility. They can also tack on a 3rd year, which would grant them an extra 25% of the original loan balance. So if an RN of yours has $100,000 in debt and they're granted this award, they would receive $60,000 paid to them monthly over a 2-year period. And then halfway through the 2nd year of their commitment, they could apply for a 3rd year of additional an additional commitment for the 3rd year, and then receive another $25,000 over the 3rd and final year of their commitment. Again, this is in monthly installments for them to repay their student loans. This is for your registered nurses, nurse practitioners, certified nurse midwives, clinical nurse specialists, certified nurse anesthetists, and nurse faculty. So you needn't even be seeing patients to receive this loan repayment program. If you have an RN that's doing administrative duties, he or she can still apply to this program. So eligible site types, again, this is more inpatient focused, but there are some outpatient facilities that are included on this list. So it's your hospitals, your rural health clinics, your urgent care centers, ambulatory surgical centers, home health agencies, dialysis centers, and your nursing homes too, including hospice as well. When we're looking at the funding delegation, 50% of it is for your nurse practitioners, 40% is going to your RNs and other APRNs, and then 10% of that is going towards your faculty. And on an individual basis, their selection criteria is based on the HPSA score. So the higher the HPSA score, the more likely you are to be funded. A score of 14 or higher gets you into the either tier 1 or tier 2 of the funding class. Tier 1 is based on those individuals that have a greater debt to salary ratio. So if that same RN that has $100,000 of student loans, if he or she is making $90,000 per year, then their debt to salary ratio is above 100%. So they would be in tier 1. If their debt to salary ratio is below 100%, they would be in tier 2 with a HPSA score of 14 or higher. And then tier 3 and tier 4 have HPSA scores of 13 or lower, and is based on your debt to salary ratio.
And that's when it's really helpful to know what the exact individual that's applying, where they're most likely to receive funding. So if it was an NP that was making $80,000 and owed $35,000, they, depending on the score, likely want to look at the National Health Service Corps or maybe a state loan forgiveness program if the odds of receiving loan forgiveness looked better. Thank you, Alex. So I am going to just show a multi-state layout with primary care HPSA status. So you can, I guess that's coming up here. So to find your primary care HPSA, you can go to the data.hrsa.gov, and you can see that in red here at the top. This website, and you can punch in your address to see what is your primary mental and dental status. Here's an example of a hospital in Stevens Point, Wisconsin. So you can see it says dental HPSA, yes. Mental HPSA, yes. Primary care HPSA, yes. If you look more closely, you can see that the status is proposed for withdrawal. So that federal review that happened in September put all three of these, the primary, mental, and dental, into proposed for withdrawal. And so what happens at the federal level is they kind of give you a heads up that the designation is not passing. Maybe the poverty dropped and it's no longer eligible for a population HPSA. Maybe there was an increase in primary care physicians. Maybe the surrounding areas have now enough physicians to alleviate their shortage within a 30-minute drive time. So there can be multi-variables and reasons as to why the designation went into proposed for withdrawal. However, in end June, beginning July is when the federal register will be updated again. And if a continued shortage is not proven, they will be withdrawn. For the rural health clinics, whether you're moving, maybe you outgrew your facility, or there was a flood and you had to move, or maybe the landlord decided to hike the rent and you want to pick up and go to a different area, maybe you're purchasing one or setting up a new one, you have to look at the designation date. So the designation date is 2017 here. And so it has to be, let's look at the primary care. Here it is, 10/27/2017, and it has to be designated within the last 4 years at the time of the survey. So whether that's the compliance team coming out and completing the survey or the state, then at the time that survey happens, you have to have been designated within the last 4 years. And so do not look at this last updated date, because the last update was September 10th, and that's when it went into proposed for withdrawal. And so we have heard a lot of confusion from primary care outpatient clinics that are hoping to become RHC and believe they were in a current HPSA because of that last updated date. But that's when it went into proposed for withdrawal. And here on the Am I Rural website, you can see, are you in a primary care HPSA? Yes. And again, you do not want to look at the last update date. It's not showing here that it's in proposed for withdrawal, but it was designated as of 2017, and you have to go 4 years out. Here's a view of the primary care HPSA outlay in Arkansas, Tennessee, Mississippi, Alabama, part of Louisiana. And you can see in red, those are all proposed for withdrawals. A lot of them are full counties, but you can see in the larger cities, these are smaller designations based on socioeconomic barriers. And you can see how many of them also went to proposed for withdrawal. The green areas are population HPSAs, and as we discussed, they provide all benefits except for that 10% Medicare bonus. The bluish gray areas are geographic HPSAs, so in general, they do not have enough primary care physicians to see that resident civilian population, and so any MD, DO seeing patients there outside of rural health clinic, FQHC, VA are generating that 10% bonus. You can see quite a lot of these HPSAs went into proposed for withdrawal. And it was a massive lift for these states. They generally have 1 to, California has 4 people reviewing. All of the primary mental and dental designations. They also deal with National Health Service Corps, grants, visa waivers, so they wear many hats, and for them to review all 3 cohorts in a relatively short period of time, I mean, think of every city and every county in the state. It's a massive data pull to be able to get an accurate picture with all of the physicians and dentists and core mental health workers moving around. Here's a mental view. So these are mental HPSAs. The mental HPSA, it may not seem important if you're not providing any behavioral health, but these mental HPSAs can be used for nurse score at the rural health clinics. And so whichever score is higher, your primary or your mental, you can use that score. And so when you see, just massive swaths in certain states of their mental HPSAs going into proposed for withdrawal, those scores cannot be used. The day they go into proposed for withdrawal, you cannot find it in the portal to attach that HPSA score to your application as an RN or NP or CNM at a rural health clinic. And a lot of rural health clinics, especially if they're not attached to hospitals, are for-profit. And this nurse score program opened up to for-profits, and it will be open up for at least the next 4 years. So now is the time to utilize that and apply. We spoke briefly about J1 and H1B recruitment. So these visa waiver physicians, they are completing their residency here in the US, and they could be from Canada, they can be from across, around the world. And when they complete their residency, their student visa expires about 6 months after that residency is completed. And if they can find work in a HPSA, such as at an RHC, they can receive a waiver where they do not have to return home for 2 years, is normally the requirement. And so they can stay here and they can bring over their spouse and their children, and the minimum requirement's 3 years to work in the HPSA. And hopefully after then, they have established roots and decide to remain in your rural community. The main federal program is the Conrad 30 program. And so there are 30 slots per state. We have seen in the past, even large states like Texas not fill all 30 slots. So it is worth looking into. And if you have not been able to fill your physician advertisement slot for with an American physician, then you can recruit one of these foreign physicians. And a third of those slots are reserved for specialists. We're going to go through just a few grants. So there are 40 state and federal grants tied to HPSA. If you wanted to develop a residency, predoctoral, podiatric residency, graduate training, faculty development, there are grants out there. We see the grants average about 220,000. Grants for physician assistant and nursing programs, dentistry, mental health, allied health, special project related grants, faculty training projects in geriatric medicine. And these are both at the state and federal level, so there can be state grants for recruitment, retention, signing bonuses, insurance, mental health, clinical, and aid service related grants. SAMHSA grants to improve the quality and availability of substance abuse prevention, alcohol and drug addiction treatment, and mental health services. Grants for health administration traineeship, improve resource coordination and development of primary care offices, and grants for facilities to improve the health status of minority populations. This rural health clinic slide, you know all about it. You have to have a current MUA, current HPSA in place that's been designated, not updated, but designated in the last 4 years at the time that that survey is completed. You can use a proposed for withdrawal as long as it was designated less than 4 years ago. And the benefit is that heightened Medicare, Medicaid reimbursement. And I feel like I'm preaching to the choir, but you know, before COVID, there was no cap on the provider-based rural health clinics. The last average I looked at 2 years ago was 245 per provider-based rural health clinic. Independent type RHCs pay enhanced Medicare reimbursement, and right now we're at 113 as of January 1st, 2022, and that is climbing $13 per year until we hit the independent RHC cap of $190. Oh, let's see here. This somehow repeated. Okay. So HPSA benefit support. So all of these programs are out there. There's state and federal loan forgiveness programs. There are grants. You know, the option to set up as a new RHC. And so how we can help is really market those programs, walk the clinicians through the process, complete the site validations, whether it's the Nurse Corps or National Health Service Corps, and take the workload off of administration. So whether that's current clinicians or future ones, they can just contact us. And a big part of it is we see hospitals in the same health system where they are Nurse Corps approved and they are eligible sites, and one is utilizing and really marketing the program and receiving hundreds of thousands in loan forgiveness, and the other is at $0 over the past 5 years. And so a lot of times it's really knowing that the program's out there, that you're eligible, that it's not that difficult, and then having someone really walk you through. It's good to have a timeline. So this is an example in Kentucky. So when the Nurse Corps would be opening, when the National Health Service Corps loan repayment individual applications would be happening, when the site certifications would be happening. And these do change year by year. We expect the National Health Service Corps site certification. So if you're a RHC and you're not NHSC site certified, we expect that to be opening in March. So here any day. There also are the state loan forgiveness programs, STAR programs, SUDS, and then actual awardees maybe towards the end of the year. And that used to be 2 years ago, it used to be in the beginning of the year, January through March, and we saw it open again in September, October. it's good to have the information, just a 2-page handout where it's showing this is the program, this is how much we're talking about, who is eligible, and what are your next steps. And so to have that information in the eligible sites, whether it's in the break room, in the waiting room, that the clinicians can see what is available to them. A lot of the physicians and especially advanced practitioners are carrying around a substantial amount of debt when they are also having the healthcare of individuals in their hands. So to have that weight of the education debt taken off of their back, or know that it is at least being dealt with and through a tax-free method, that is very encouraging for them. So good ways to get the word out. Here's an example. It's really looking at just all sites and what's open to them for each program, each clinician type, whether it's for-profit, not-for-profit, depending on the score, the facility type. And so it's good to really break it down and let everyone know what's open to each clinician type at each facility. So I'm sure there are questions. What questions do you have for us?
Okay. Oh, okay. Hey, Joe. Okay, Alex, thank y'all very much for that information. Danny, have you started accumulating our questions so that we can ask Joe and Alex?
Yes, sir.
All right, let's go.
Okay. The first one says, just to clarify, if a provider has been approved for funding through a state loan repayment program, would they still be able to apply for the National Health Service Corps program?
So they do not want you double dipping, applying to multiple programs. So you do have to adhere to the original service agreement, whether that was through the hospital, maybe the hospital paid you money out of pocket to commit to staying for 2 years, then you cannot apply to National Health Service Corps or Nurse Corps. But we do see clients saying, we're gonna walk you through this program, and if you do not receive funding, then we will help with your education loans. We see that the same with rural health clinics. So they'd originally tried for the tax-free funds. That's not necessarily, it's not out of pocket. And if that doesn't work, then they'd have a backup. But otherwise, if you have a current service agreement, you do have to fulfill it, whether it's at the employer level or state or federal.
Okay, thank you. I'm confused on the 4-year designation status. Many of our clinics showed designation back in the 90s or early 2000s, but the update is current.
So the HPSAs are required to be reviewed as there a continued shortage every 3 years. And they did a mass update in September, like we spoke about. But the designation could have been in place since the 90s and just never been withdrawn. But they do have to be reassessed as there a continued shortage, and that's every 3 years. The MUAs are different. They can be in place since 1978 and still be good for visa waivers and FQHCs, but not worth anything for rural health clinic setup or relocation or change of ownership.
Okay. I think that one thing, and you can correct me if I'm wrong, on Cassie, when you're looking at yours, yes, it was updated in say September, but was it updated to say proposed for withdrawal, or was it updated as designated, right? Would that be correct, Joe? You're kind of looking at what the update says. If it was updated, but it doesn't say proposed for withdrawal, then she's good.
Correct. If it says updated and designated, you're good to go.
Okay. On the flip side, if your HPSA is in the proposed for withdrawal status, what does that mean for their future? Should we make any strategy adjustments, for example, recruiting, etc.?
So like I said, it does affect the loan forgiveness programs if you're in proposed for withdrawal. If you are a rural health clinic and you're already established as a rural health clinic and you do not move, you do not change ownership, you are grandfathered in. Same as if your area became urbanized, you're good to go. But in the event that you did outgrow your facility or you had to move for any reason, it's nice to have the HPSA or MUA that has been approved in the last 4 years in place, so that you have that opportunity or option. It's kind of like an insurance.
And from a recruiting standpoint, if you are in proposed for withdrawal, it's anticipated that you will either be renewed or officially withdrawn in June or July of this year. So if you are withdrawn, you will not have access to the state or federal loan repayment programs. So that would be something that you would want to adjust for your recruiting strategy. If you have questions about how to get the designation back in place, it's certainly something that we can speak about with you to keep you designated.
Joe or Alex, I guess my question is, I know I've seen a lot of political maneuvering recently. I know I shared the American Hospital Association letter. I know the National Rural Health Association has written a letter. I'm not sure if the NARHC has written a letter or not, but that's something that we're all very concerned about. I mean, the numbers that Joe gave me was 40% of all of these designations are being pulled effective June 1st or July 1st when it goes into effect. And that's going to have a dramatic impact on rural healthcare, especially with us coming out of this pandemic. I mean, is there hope for this to be sort of moved back a year or 2 years or something like that? Or what's happening on a political standpoint?
So I also saw those letters, Mark, and they're coming, like you said, from the Hospital Association, from the Rural Health Clinic Associations, delaying a proposed for withdrawal from being withdrawn. A lot of the benefits did leave when they went into proposed for withdrawal or when they were not updated and they're more than 4 years old, right? So like we were saying, the nurse corps and national service corps, you cannot attach an application for loan forgiveness when it's in proposed for withdrawal. Same with the Medicare incentive payments. So the MACs will not honor that proposed for withdrawal and actually pay out those bonuses. And if an employer has quite a few physicians under their umbrella, that Medicare bonus can be substantial when it's every specialist, pathologist, radiologist. So delaying the withdrawal doesn't really solve the problem. They're in proposed for withdrawal. And that's pretty much what I saw with the letters. So that's my thoughts on that. Alex, do you have anything you wanted to add?
No, that sounds about right.
I guess another question I have is for these clinics that want to become an RHC and they're in the process of becoming one. They've gotten their letter approved from the MAC saying that 855A is good, and now they're in the process of getting a survey, and everything is going forward. And then they see this thing that says it's proposed for withdrawal. I guess my understanding of the impact is they're not going to be able to be an RHC, and then unless their 855A was approved before the proposed for withdrawal came about. I'm very confused on the timing of all of that. Joe or Alex, can you help me with that?
So what I've been hearing from various RHCs that are trying to go through the process is that when they come to the survey, even if the 855A was approved, they do double check, are you in a current HPSA that was designated in the last 4 years? And then they're denied. And so a lot of them are coming to us saying, is there any way we can prove that there is a continued shortage and get this put back into place?
Mm-hmm. Yeah, I know this happened to me, I guess once or twice in doing this 35 or 40 years is and I don't know if this rule still applies today, but the rule back in the day was the last step was when Medicare and the regional office issued the tie-in letter, they would look to see if your area was still in an underserved area or if it had been withdrawn. And at that point, if it was that status, they would not issue you a CCN number, and you'd spent all that money on us, on consulting, and then on TCT and Quad A to get them to that point, and they couldn't be an RHC. And that happened once or twice. But that sounds like what could happen to you today. So first thing you want to do is double check, just make sure that your area is not proposed for withdrawal before you spend a bunch of money going forward with this. I guess is the way I would tell our clients. Is that right?
That's right.
That's correct.
Yeah. Okay, Danny, you got some more questions here? I see one about marketing materials, maybe.
Yeah, Denise says, is it possible to order any of the marketing materials that you displayed for the various programs and customize them for our organization?
It definitely is. So as you noted, it is dependent on score, on type, on area. Some states have incredible loan forgiveness programs that cover absolutely everybody, and others are biennial. And so it would be specific to the organization, but yes, that's possible.
Okay. And then this is a fairly new certified RHC, and she said she's confused about the grandfathering of an RHC. We are in proposed for withdrawal, so can I apply for the National Health Service Corps or not?
So you still can apply to become site certified, but if a clinician's applying and they're in proposed for withdrawal, I do not expect them to receive funding. It's at the time the applicant is reviewed. So they'll look at it and say, are they in a current HPSA that's designated, and make that determination. The benefit of being an RHC is that if you do go through the National Health Service Corps process and you are site certified, you can receive that facility score. And you can use that facility score for National Health Service Corps loan forgiveness. So even if that area HPSA disappears, you can still use that facility HPSA score.
Joe, when is this application? You say this applications open up very soon for the facility applications. Is that right?
Yeah, it's
Yes.
within the next month or two, they anticipate this window being open. There are a lot of stipulations that need to be satisfied to become National Health Service Corps site certified. So be prepared to jump through some hoops to get your site certification. And it's definitely something we can help with if you're interested.
Sliding fee schedule. I think that's one of the big ones that you've got to have to be in place ahead of time. So if you're thinking about doing it, talk to Joe or Alex soon so you can get that sliding fee schedule in place in a timely amount of time to do that. So let me ask this is a solely personal question here, but it's a daughter is 21. She's a junior in college. She's got a biology major, and I was looking up stuff at the seminar yesterday, a National Health Service Corps scholarship program. It says that they will, when she goes to PA school, they will pay for her tuition, required fees, reasonable education costs, and even a monthly stipend, which we could really use that to pay for Starbucks, let me tell you. So can rural health clinics work with the people that are juniors and seniors in college to let them know about this program? Because they have to go to on the list here is an FQHC, a rural health clinic, hospitals in rural areas. So are there programs where you can sort of link those together? Because I've been doing this for 40 years and I wasn't aware that my child could get this paid for this way until just yesterday.
Yes, that absolutely is true, and she can graduate without education debt, and then she'll have to work in a HPSA, and hopefully she'll choose one of your rural health clinics, and then we can speak about that too, Mark, offline. And I don't know if Alex wants to talk about a personal story, but it's it's open. We've helped even local community sociologists and social workers go through the loan forgiveness program and have all of it taken care of.
Something that should be a lot of recruitment. Oh, go ahead, Alex.
a lot of these loan repayment programs can be proactive instead of retroactive. So you can apply to a scholarship instead of loan repayment. So you'll get the money up front to commit to working somewhere instead of getting it afterwards and being employed. So yep, you can do it before you even start.
Yeah. Yeah, to me, as you know, from the rural health clinic standpoint, you know, if you know you've got somebody that's really good in your community, you know, reach out to them early, junior or senior in college before they get to this point and say, hey, we're the rural health clinic. Maybe we'll help you with some additional stipend as well to get you through this time. And that would be a great way to get these people back into your community. That's going to be one of your great recruiting tools there. So getting back into the questions here, Allison has the proverbial elephant in the room is what can be done to address the huge number of places in Tennessee that are proposed for withdrawal. If they're withdrawn, is there any recourse after the fact? Because Tennessee's going to lose huge numbers of shortage areas. And I looked at it just yesterday, and we had 8 or 9 pages of shortage areas that we're going to lose just in Tennessee. So is there something that can be done proactively, or is it just, you know, hire you guys and you guys can do your magic and get it back as a health professional shortage area, or what can be done?
I think it's worth looking at your specific area, Allison. There are often times when we can step in and help provide the data necessary to get your designation put back in place. And if it looks to us like it's absolutely impossible to get a designation put back in place, we can tell you that. We'll let you know that the numbers are just not going to work. And unfortunately, you're likely going to be withdrawn. But if there's a chance and it looks like we can provide the state some data that would get you redesignated, we would speak to you about a project and hopefully get your designation put back in place for you.
Okay. Okay, and then Kate is on here. Kate Hill is on. She says the CMS memo says that you cannot deny until it's actually withdrawn. So that's good news. If you're becoming an RHC and it's not actually withdrawn at this time, you can still go forward and be an RHC. So thank you, Kate, for that update. I know she sent me some information this morning, and I will post that to the Facebook group there. It's basically just a link to a memorandum from CMS from 2014. So I'll link that for everybody to have that. Dan, you got any other questions in here that I missed?
Yeah, there's a couple. We have been told that Alabama has not reported its data yet, causing the proposed withdrawal to still be showing on most every county. Do they have a deadline to get this done? This is causing major issues for us right now, as well as for future plans.
So the deadline we're looking at, we see the Federal Register update by the first week of July. And so that really is the deadline that everyone's looking at, where those proposed for withdrawals have been notified, and if additional information has not been submitted, then they will be withdrawn. It's different for every state. You could see in those primary and mental HPSA maps that certain states were doing really well for primary care, maybe not so well for mental. There are also certain states had a lot of turnover where people were retiring or switching positions, and those, you know, the clock keeps moving forward. So who was addressing the proposed for withdrawals, or who got the information in before that federal review, the HRSA update 2.0. And so certain states fared better than others, and certain cohorts fared better than others. And the same thing will happen with this review of the proposed for withdrawals. Certain states will fare better and certain cohorts will fare better depending on what they focused on.
Thank you. Does the facility HPSA ever need to be updated for an RHC outside of a change of location?
For an RHC outside of a changeable location?
Yeah, outside of a change of location, does the facility HPSA ever need to be updated?
So once your National Health Service Corps as an RHC, your facility HPSA is automated. So you're good on that moving forward. Sometimes it's a leap of faith as an RHC to go through all of the National Health Service Corps site certification and with the expectation of being approved and then receiving the score. If you don't know exactly what the score is going to be, and maybe the area HPSA is low or in proposed for withdrawal. But once you are NHSC certified, that's one of the big benefits of being a rural health clinic, is that facility score and having that automated.
I think we've got a couple left. Cassie said we were told by our state office that the proposed for withdrawal could change the census data coming out this month. Is that correct?
So the census data will be changing. And so HRSA has a software that reviews these designations. And right now they're using a 2019 American Community Survey. And so that is the demand side, right? The demographic side is the demand. What is the population that needs services? And obviously that will change because it's a projection, and that will change. They're projecting in April to have that updated with the 2020 census data. And Alex and I received an email about that, that those figures will be released here shortly. So that will change the demand side of the equation. Certain population HPSAs, could be now eligible for at least a consideration. So it is out there, and that is true.
Thank you. One more. I know we can't move from our location, but if our building has any type of damage, for example, a tornado, fire, etc., and needs to be rebuilt, would we still be grandfathered in as an RHC clinic if we rebuilt in the same exact location?
So what would you do in the meantime? Just not see patients, I guess, is my question. But as long as it's the same.
That is a good question. I know that issue's come up before, and we've had it happen. We've had tornadoes come and destroy clinics, and I don't remember now what exactly we did, because they were in an area that was grandfathered or had lost its status. So that is something. I know that the National Association of Rural Clinics one time was looking at that. I know Bill Fennerfrock was working, and maybe Nathan and Sarah were working on that at one time, of getting something into the Medicare RHC Modernization Act that addressed this exact issue, because this does happen, especially with the way the tornadoes are now. There's much more of a threat of something like this happening to our RHC. So
yeah, absolutely. We had a rural health clinic in Pennsylvania, and they were hit with just a water pipe burst on the second floor, and so they could no longer function on the first floor. And they wanted to keep billing as an RHC, but their HPSA had expired. And so we helped to get the HPSA back in place, and they were good. And it was a year to the date that a tornado hit the same RHC. Luckily, it was at night, and I had to call the CEO to say, is this really possible? And he's like, yeah, but luckily no one was there, and we have to move again. But they had a HPSA that was only a year old. But yeah, if you're in the same location, same name, same address, you should be good to go. I just don't know what you do in between while you're waiting for that to be built, especially with the delays going on now with some of the building.
Yeah, so it sounds like a good thing to put in your emergency preparedness plan for continuing operations after an emergency. That's sort of something that you want to think about, is how you would address that situation. And unfortunately, we've had a lot of our RACs have to deal with that. I know the flooding down in Louisiana. Oh my goodness, we've had several clinics down there that had to basically get up and running. I think we had one that got completely destroyed. They had a one in 1,000 year flood one week, and then about a month later they had a 1 in 500 year flood, and it wiped out what they had done. So it's not uncommon. So
Yeah.
So let's go ahead and close it down. We're right on the hour. So Alex, Joe, thank you for everything. Thank you for everybody listening today. Have a great day. It's beautiful out there, and we will see you guys in San Antonio if you're going to the National Association of Rural Health Clinics. So thank you.
Thank you.
Bye, everybody.
Thanks, everybody.
Thank you.